Well, hello everyone. Welcome back to our weekly Facebook expert series. Today, my guest is Dr. Darin Ingels. I've known for a few years, but let me tell you a little bit more about him. He is a licensed naturopathic physician, author, international speaker, and leading authority on nutritional medicine. He is a former Lyme patient who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingels found that proper diet, lifestyle management, and natural therapies worked with his body to heal instead of against it. He then applied what he learned about diet and lifestyle management to his own patients and found they recovered faster with less side effects. He's now treated thousands of patients with chronic illness using his novel approach, many who have gone on to live healthy, symptom-free lives. And he is the author of The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. So welcome, Darin. Thanks for being here.
Oh, thanks for having me, Bridgit. I'm glad to be here.
Yeah, so our topic today is Lyme disease and mold illness. So I love interviewing people about Lyme, but I'm not really a Lyme specialist. But I know they really are frequently found together. So maybe you could just start with like defining the two and why they happen to be linked.
Sure. Well, Lyme disease itself is actually an infection. It's a specific kind of infection that's caused by an organism called Borrelia, mostly Borrelia burgdorferi. And most people who get Lyme disease acquire it through a tick bite. And we used to think that these ticks really lived up in New England and the central part of the country, but we've really now found that they're found throughout the United States. It's been reported in all 50 states. So, these ticks are teeny weeny tiny. They're about the size of a poppy seed. So when people get exposed, more often than not, they don't know, and they have no idea they got this tick bite. And the ticks themselves have a little bit of anesthetic in their jaws. So when they bite you, you don't feel it, unlike a mosquito bite or a horsefly or something like that. And when the tick bites you, it injects a little bit of its saliva into your blood, and that's where the bacteria is harbored. Once it gets through your bloodstream, it can then spread all throughout your body and cause any number of different symptoms. So we call Lyme the great imitator, the great mimic, because it looks like so many other types of illnesses, and particularly other types of infections. So when people get acutely ill, they can get headaches, fever, chills, swollen glands, fatigue, joint pain, neuropathy, numbness, tingling, brain fog. There's upwards of 100 different symptoms associated with Lyme disease. And because of this disposition to really invade any different tissue, that's kind of how it manifests in different ways. And so, for people who don't get that acute diagnosis, it can become chronic. And then, people go months, years going from doctor to doctor, specialist to specialist, trying to figure out what's wrong. And they never hone in that it can possibly be due to Lyme disease. So, when we look at the symptoms of Lyme, knowing that it can really affect kind of the neurological system, joints, and then we look at something like mold or mycotoxin illness. We know that mycotoxins are chemicals that are secreted by certain types of mold species. So if you've got a water damaged building and those specific molds are there, they start making these mycotoxins, you breathe them in, you absorb them through your body, and then you can start to get brain fog, fatigue, cognitive impairment, neuropathy, sleep problems, mood changes. So when we start to see this litany of neurological issues, clinically it can be very difficult to distinguish, what's Lyme disease, what's mold, or, potentially other types of illnesses. So as clinicians, I think this is where we get into a lot of discrepancy on, trying to delineate what's really the root cause. And I find so many people who have Lyme disease also have mycotoxin illness or mold illness, and vice versa. And I guess it's sort of, which one begats the other, right? Because both of these can have a negative impact on your immune system and cause immune suppression. So if you're living in a water damaged building, those mycotoxins suppress your immune system. If you get exposed to a tick that might carry Lyme, your disposition to getting the infection is probably greater. But if you started with Lyme disease, Lyme started impacting your immune system and you live in a water damaged building. Now those mycotoxins might have a more profound effect. So, that's kind of an oversimplification of two very complex illnesses, but I think that's where we see this clinical overlap that, again, as clinicians can be very difficult to distinguish, one from the other. So we have to kind of, put on our detective hat and chase each one of those things down, because I've heard other clinicians say, well, you can't treat Lyme until you deal with the mold issue. You can't deal with mold until you deal with Lyme. And it's all kind of nonsense, really, because if they're both bothering you, you need to deal with both, because the way you treat, an infection is very, very different than the way that you're going to treat mycotoxin illness. And I think we would probably agree at the end of the day, it's really about like fixing the terrain, right? It's about finding those core root cause things that all kind of chronically ill people tend to suffer from. And as we get the person healthier, their ability to excrete and eliminate helps with their mold illness. Their ability to support their immune system helps with chronic infection. So although we might have very specific therapies we do for both, in reality, I think, we're still coming back to these fundamental things to help the body heal.
Yeah, I think that's a good point. And it's a little bit wasted energy debating all that too much. I probably heard both things. Like I've heard some people say their Lyme basically healed on its own once they improved their terrain and got out of a moldy place. But then I've, definitely heard stories of people who, once they finally directly treated Lyme infections, everything turned around. So I think it could definitely go either way. We had a speaker on a while back, and he was saying in his personal case history, he thinks he was, bit many times as a child, and then later lived in a moldy house, and that let his Lyme come to the surface. Do you see that and agree with that? What do you think?
Yeah, I think Lyme's an interesting organism because we actually have little evidence that if you get exposed to Lyme that you ever get rid of it completely. It's kind of like, if you get exposed to Epstein-Barr virus, the virus that causes mono, once it's in your body, it's there forever. It never leaves. So it doesn't necessarily mean that you have mono or that you get any symptoms from it. It's just there. But, I guess I think about like, chicken pox too. You can get chicken pox as a 5-year-old, get shingles as a 55-year-old. It's the same virus that's been in your body for 50 years. What's the difference? Well, the difference is the terrain or the immune system. If you become immune compromised, the disposition to having that virus, start to become more active is there. And that's when people get shingles outbreaks. So I think Lyme, to a certain degree, again, is a function of the immune status, the terrain. And I could certainly see where someone might have been exposed to Lyme, in their childhood, their immune system was healthy. They took care of it. They never got symptoms, but fast forward 10, 20 years later, they're living in a moldy home. Now, again, there's more immune suppression, other toxins that are impacting their body. And now what was kind of sitting dormant now becomes more active, and you start to get these symptoms. And, again, it's always hard to know with someone with Lyme, when their exposure occurred. There's nothing in our testing that gives us any clues of the timing. So I think it's possible. And again, I've seen that in my own practice of people. As far as we can tell, their exposure probably happened many years prior to the onset of their illness, but there was that catalyst of something like mold illness that just kind of brought everything to the forefront, and then they became symptomatic.
Got it. Yeah, I have never tested for Lyme. I'm going to ask you about that in a minute, but I have seen my EBV come to the surface when I was sick with mold. So I actually got found before mold. I was treating EBV for at least a year, maybe more, and kind of holding on, kind of making progress. But then the mold piece really helped me a lot. So I know about testing for mold, looking for mold and all that stuff. Lyme testing, I feel like there's another hotly debated area. Yeah. What's your opinion on the best way to test, if it's accurate, that kind of a thing?
Yeah, I think it's kind of interesting in some way. Everything obviously going on with COVID-19, sort of the questions about the accuracy of the testing. I kind of feel like Lyme testing's been there for the last 40 years. It's like, how accurate is it? Is it really picking up everything we want? The reality is that Lyme disease is a clinical diagnosis. It's based on your symptoms. It's really not entirely based on testing. In fact, the testing that's out there was never designed to be diagnostic. It was really designed as a tool to monitor people as surveillance. So, these are people who had classic Lyme disease. They had the bullseye rash, they had the joint pain, the fever, the whole gamut, and they wanted to monitor them over time. So in the 40 plus years we've had this test available, we've never changed the criteria of what we kind of call as, a positive test. So, the CDC has a very strict criteria that you have to have 2 out of 3 IgM antibodies or 5 out of 10 IgG antibodies on a Lyme Western blot. And even prior to that, actually, you do a screening test, which is just a combined IgG IgM test. If that's positive, then it flexes over to this more specific Western blot. But again, we know when you look at the research that the sensitivity of the Lyme screen is somewhere between probably 46 and 54%. So basically maybe picks up half the people that have Lyme disease. I was a microbiologist before I was a doctor. I used to do these tests. I'm like, that's a terrible test. If it doesn't even pick up half the people that have the illness, it's not 50, a very 50. Exactly. I mean, 50% in most things isn't very good. And certainly when it comes to trying to figure out if someone has a very serious chronic illness, that's terrible. So, we use it as a tool to help determine, have you had exposure? And we've known in the research that some of the antibodies you make on that test are very specific to Lyme. Some of them are not specific to Lyme. So again, why we've never kind of changed and say, hey, why don't we just look at the Lyme specific antibodies and ignore kind of these not so specific antibodies. So on a Lyme Western blot, we know that the 23, 34, 39, and 93 antibodies are very specific to Lyme. So in my world, if I see someone that has one Lyme specific antibody, but not 2 on IgM, they've got 3, but not 5 on IgG. If they're Lyme specific, I mean, I guess the way I think of it, it's like being a little pregnant, right? I mean, you are. So if if there's such a thing as a little bit of Lyme or a little bit of, mycotoxicity. So when you've got evidence that you've had that exposure, we have to put into consideration with the patient. I mean, do you have the symptoms to support that? But if we see on paper that we have evidence of Lyme specific antibodies and you have symptoms and we've kind of ruled out other possibilities, do you have other types of autoimmune disease? Is there some other underlying illness? We have to kind of do our diligence and make sure it's not something else. But, generally in medicine, if it walks like a duck and quacks like a duck, it's a duck. So if you've got, evidence on paper of Lyme specific antibodies, you've got clinical symptoms, you've ruled out other possibilities, that's really our impetus to kind of move forward in Lyme treatment.
Okay, perfect. Well, let's talk about the treatment, and maybe even before we my dog is like scratching the wall or something. I'm not used to that sound. I've also heard you could potentially use some treatment modalities for like specific blends for these infections to see how you react to them as a bit of a test too. Do you find that? Yeah. Okay.
Yeah, I know a lot of doctors will, again, if you're not really sure, you can always do a therapeutic trial of treatment. And if you're on the right track, and this is not uncommon in medicine. I mean, if you go to the hospital and you've got, chronic fever and they can't, they do cultures, they can't find out what's wrong, they'll give you antibiotics in the hospital just to see if you get better. So, the same concept is that if we're really unclear, let's do a therapeutic trial of treatment. Now, I guess it depends on who you're working with and whether that's antibiotics or you're using herbs. But if you institute any kind of antimicrobial therapy and you see clinical improvement, that's a pretty good, marker that, you are dealing with some sort of underlying infection. And, we know with Lyme too, that there's the possibility if you get bit by a tick, not only does it carry Lyme, it has the potential to carry other infectious agents. So we've got this very long list of other bacteria, viruses that can be transmitted through a tick bite. So we know that up to 30+% of ticks in New England carry more than just Borrelia in the tick. So when they bite you, you might get Bartonella, you might get Babesia, you might get Anaplasma, you might get Mycoplasma. There's just so many other things it's possible to get. So often we're dealing with co-infections and not just the primary Lyme infection. I think kind of the beauty of herbs is that a lot of herbs, because there's so much overlap in what they're dealing with, they treat a lot of these other underlying co-infections. Where if you're using antibiotics, you really want to be very specific, because we know that some antibiotics work well for Lyme, but they don't work so well for Bartonella. And so you got to use different combinations. But nonetheless, there's certainly no harm in doing a therapeutic trial if you're really unclear, and give it 3 weeks. Do we see any clinical improvement at that point? If we see the needle move in the right direction, that's a pretty good indicator that you're dealing with an infection. And now you could go further on in that treatment to see how far you get.
What if you have a lot of side effects and reactions in that 3 weeks? Does that mean you probably have it, or just sometimes we react that way to herbs?
Yeah, I mean, when you're treating, Lyme and other chronic infection, you can get a die-off, effect. We call it a Herxheimer reaction. And it's kind of a combination of the organism dying and expelling all the toxins within it, plus, what your immune system is reacting. That combination can make you feel very flu-like, make you feel tired, make you feel achy, make you feel just, blah. And when that happens, I think most of us kind of cheer that, yeah, and that's probably a good sign that, we are getting to the underlying cause. However, a true die-off reaction tends to be transient. It tends to last probably not more than 7 to 10 days. So if you're in a 3-week course of treatment and you feel miserable the entire 3 weeks, it's probably less likely at that point it's a die-off reaction. It could very well be that you're just having an adverse reaction to whatever you've been given to treat.
Oh, gotcha. Perfect. Could you share some of your favorite herbals or supplements or blends or what have you for Lyme?
Yeah, I mean, there's so many, and there's a guy named Dr. Zhang, Zhang. He's a researcher at Johns Hopkins University, and he's now published several studies in collaboration with one of my naturopathic colleagues, Dr. Jacob Leone. And they've been looking at herbs and treating Lyme and a lot of co-infection. And we know from their research, now again, this is in vitro, so take it for what it's worth, but in test tube studies, we find that herbs like Japanese knotweed are highly effective. Cryptolepis are highly effective. Cat's claw, very, very effective. We know that Artemisia is one of my favorite herbs. I use it a lot for Lyme. And Artemisia is also an interesting plant because in addition to killing a lot of bugs, it has an immune modulating effect. So we'll give it to people that have like rheumatoid arthritis or other types of autoimmune disease. So Artemisia can be very effective. There's an herb called Hatunia that's used a lot in Chinese herbal medicine. So, we've got, fortunately, I mean, lots and lots and lots of herbs. And again, I think the beauty of herbs is that not only do they target the organism, but you look at an herb like cat's claw or otaba, these plants, in addition to being antimicrobial, are actually anti-inflammatory. They're very potent anti-inflammatories. So if you've got inflammation in your brain, inflammation in your joints, inflammation in your gut, having something anti-inflammatory is actually really quite beneficial. They help promote better circulation. They help boost your immune system. They help support your adrenals and other, glands. So we can mix and match these herbs to each individual person based on what their, needs are, so that we're really covering the broadest base of what, Lyme and these infections have done in your body.
Awesome. Yeah, I was just interviewing someone from biobotanical research, and where she was kind of talking about the same thing. It's like, I think like we get a lot of these questions, like if I take this, isn't that killing everything off? And it's like, it doesn't work the same as a pharmaceutical. And look at all these wonderful benefits you're saying. Like it's so complex, like it can sort of go after something and enhance something else at the same time. So
yeah, I think it's fascinating when you look at plants. It's almost like our gut bugs have a wisdom to recognize it's a plant and not a pharmaceutical. And again, we just don't see the same level of gut disruption when we use plants like you do if you're taking doxycycline or amoxicillin. They're much better tolerated. The likelihood of having an adverse effect is very, very low. Again, I think they just integrate into our body in a very different way. So it's not that we still don't support gut health. We absolutely do, even when we're using herbs, but they're just tolerated generally so well. But converse to that, I also hear people say, oh, well, if I'm using herbs, they're really not that strong. It's not like taking antibiotics. Look, I have some people to take one drop of one tincture and they start to get die-off reaction. So
true.
Anyone who might be
Yeah.
under the impression that herbs aren't strong, I mean, understand too, like in Chinese medicine, right? I mean, they've been using herbs for 5,000 plus years very effectively, as teas and powders and capsules. So, we've got a very long history in the United States and around the world of using herbal medicine to treat various conditions. And again, depending on how the herbs get concentrated and made, they can be highly, highly effective.
Yeah. Yeah. And I don't know who I was interviewing, Cindy. What you generally buy at the grocery store is not going to be as strong as what you get from practitioners. And we have to be a little careful with our shop because everything we sell is like practitioner grade. And so we really try to say like, yeah, you might not feel good. And that's because something's happening. So, here's how to deal with it and all that. So yeah, I love those suggestions. If people are really interested in Lyme, they can, get your book. I know you've got a lot in there. I'd love to talk next about this connection with autoimmunity. So perhaps both these conditions, since you have experience with both.
Yeah, well, I mean, Lyme in particular, we know when you look at the research that, in the effort to clear Lyme from your body, you can make these autoantibodies that target your brain, that target your peripheral nerves, that target your joints. So a lot of the symptoms that people experience with Lyme disease can actually be the immune reaction to Lyme and not the Lyme itself actually causing the problem. It's almost like if you didn't have an immune reaction, you'd feel fine. So if it has this disposition, and I think this is where a lot of chronic Lyme patients fall, it's not even so much that the infection is in certain areas of the body that's really triggering the symptoms. I think, even if there's small amounts elsewhere in your body that are triggering a strong immune response, now that those autoantibodies are kind of circulating around your body and your tissues, that's where you start to get these long-term, effects, particularly the neurological and arthritic effects. Same thing with mycotoxins. We know that mycotoxins, have this capacity to trigger, autoantibodies. So when you're loaded with various toxins, that disposition towards autoimmunity is much greater. And, we also know that there is a shift in your TH1, TH2 disposition. And for those of you who've never heard this before, TH stands for T helper cell. And T helper cells are really the conductors of the immune system. So if we want to think of it very simplistically, kind of imagine your TH1 cells kind of being your direct scavengers. They're the ones that go after foreign material like viruses and bacteria and try and get rid of it very quickly. Where TH2 is really more antibody driven. And the TH2 cells don't directly get rid of things. They basically start making antibodies against staph or strep or Lyme or candida or whatever else you're dealing with, so that your immune systems can start getting rid of it in a different way. And again, it's very complex immunology, but if you want to think of it a little bit like a seesaw, TH1 goes up, TH2 goes down, and vice versa. To a certain degree, that's kind of what happens. So if we start shifting that, that balance, if you become more TH2 dominant, your disposition to having more allergies, more autoimmunity kind of goes up. So, it's one of these things that actually for years and years, we've never really had a good way to measure it. And fortunately now Cyrix Labs offers a test that actually measures your TH1, TH2 balance. So we've recently started running that with some of our patients to kind of get a sense on, where is their immune system really hanging out, and, what can we do to help, get that balance, back. But I think, just sort of understanding that when you're dealing with, chronic infection, not just Lyme disease, and we know from the literature, there are, tons and tons of studies on, strep and Klebsiella and Proteus and Candida and all these other microbes have this ability to trigger autoimmune illness. And if you think about a lot of the diseases out there that are basically labels, chronic fatigue syndrome, fibromyalgia, MS, it's like we can describe what's going on. You ask your doctor, but why does this happen? They go, I don't know. It just is. Well, is it possible that, either a chronic underlying infection or a mycotoxin is the underlying cause of this autoimmune problem? And I get so frustrated with, I think, rheumatologists and neurologists to a certain degree that they're very complacent to just accept the diagnosis without really the understanding of why. And yet there's so much we can do to try and help figure out what's really going on with the person. I can't tell you how many people I've seen, been given a diagnosis of MS. We come to find out they have Lyme disease, and most of them have a ton of mold. And you start treating the Lyme, you treat the mold, and now all of a sudden their MS symptoms get better. So do they still have MS? Well, probably by definition, but is there a reason that their immune system started attacking their myelin that way? Yeah, there may be these underlying things that just have never been addressed. So I think, as again, clinicians, we just have to, put on our detective hat and kind of go down that path with folks and try and figure out, are these part of the underlying cause? Because in so many cases, they really are.
Yeah, I think it's so valuable. That at the minimum with functional medicine, we're creating awareness that there is a reason. Like, it's not just a label without any background. I was hanging out with a friend of my parents, and he was talking about his friend who has Alzheimer's, and he was saying, it's so unfair, why would God do this to us, kind of a thing. And I didn't get into it in this particular moment, but it's like, yeah, we know a lot of causes of Alzheimer's now. And, she's just kind of getting that care. And it's just such a paradigm shift for everyone involved with her. And to think, actually, there is a cause. Like, let's look at it. Like, let's see what we can reverse here. So in that moment, I was like, this is not the moment to go down that rabbit hole. But this is the moment. Yeah. It's like some of these really serious things started way back when with a tick bite, and there were symptoms, I'm sure, leading up to, this big diagnosis later. So it's so valuable. I didn't know about that TH1 and 2 test. So that's really interesting as well. I just want to point out, you're such a great educator. Like, I can just tell, that your science, and you have a great way of coming across with it. So yeah, thanks for kind of walking us through some of that stuff.
Yeah, well, I'll share very briefly. It's pertinent to our conversation. I mean, my own story. I mean, I had Lyme disease in 2002. I had classic Lyme disease. I was treated very quickly with antibiotics, and within 4 or 5 days, I felt great. But I got bit 2 weeks before I opened my own practice, and when I opened, I couldn't afford staff, so I was doing everything myself. And 8 months into that, I started to relapse. And I went back on, antibiotics. It didn't help, and I ended up going through 9 months of antibiotic protocols that made me a lot worse. And I saw a doctor in New York City who, started treating me with Chinese herbs and acupuncture. And within a month, I felt 80% better. And it was the realization, it's again, I wasn't eating well, I wasn't sleeping well, I was stressed out of my mind. And it was just the perfect storm of when I got that bite relative to where I was leading into a new business. And, it took me 3 years to, work through that and feel like I got my life back. And then a decade later, I developed multiple sclerosis.
Oh, I
So
didn't know that. Wow.
yeah. So, I can look back and say, yeah, I mean, I had that exposure to Lyme. I think, again, it set the stage immunologically. And then between all that, again, just lots of stress, emotional trauma, and other things that I know have kind of disposed to that. So I just know from my own experience that I can see how that progression kind of occurred. And I see that with a lot of my other patients. So had I known what I know now, of course, I would have probably done things very differently back in the day. But I mean, this is kind of what happens, is that when we kind of keep adding to that load on the body, at some point it starts to break down. And I also have a long history of toxic exposure. I mean, I used to spend my summers working at oil tank farms, climbing into oil tanks, cleaning them without a respirator. And I worked in a lab where we would stick our hands in xylene and like all this like terrible stuff, which when you're young, you're like, yeah, whatever, no problem. But again, in retrospect, it's like, yeah, there was just a lot of exposure early on. So when we talk about, infection, trauma, environmental exposure, fortunately, I never really lived in a moldy building that I'm aware of. I don't think that was part of my etiology specifically, but it's still toxic load. And we have to look at all of that as the whole of the person, because it's that accumulation over time that kind of sets the stage that the cells aren't functioning the way they're supposed to, and ultimately the organs don't function the way they're supposed to. So when we look at something like Alzheimer's, dementia, Parkinson's, yeah, I mean, I think we've all had that conversation with God of like, why does this happen? Why would this occur? But there is a reason, and this reason probably started many years prior to. So I think that's where we, can help educate people, particularly, younger people. There's so much you can do to help prevent getting to that stage where if you just have that awareness about your environment, what you're eating, how you're sleeping, take care of yourself early, and you're less likely, I mean, nothing's a given, but you're at least less likely to have some of these chronic illnesses later in life.
Yeah. All the things now that, give us energy and sleep, help us sleep well and that kind of thing, which is great now, also are the same ones that in the long run can help us out as well. And I think Dr. Tom says it's usually 10 years that you've been developing an autoimmunity before symptoms are such that you get diagnosed. So this is a great lead in to talk about your event. Let's see, I'm going to screen share it in a sec here, and let me make sure I put it in the chat as well. So that's the registration page. I believe I'll show that first, and then you have some gifts as well.
Oh, I just saw that Pam asked the name of my book. My book is called The Lyme Solution, Pam.
And it's on Amazon and all that, right? Okay. Actually, so I saw this was a popular one, so I'll share this one first. This is 4 hidden factors keeping you sick. So it's showing, I think it's showing us that people are wondering what's keeping me sick, that a lot of them are opting into this book. And then this book will also get you into your summit, which is here. Let's see. I can just pause that, but it starts December 6th. Here's Dr. Tom, who we talked about a bit ago. Eva Detko, I think you mentioned.
Yeah.
This is the first chapter of your book. People will get talking about EMF and chronic illness. Yeah, that's it's a whole ball of wax there.
Yeah, we've got a lot of great free stuff when people sign up. We've got Dr. Christine Schaffner and I are co-hosting this event. So she's got a great guide on, lymphatics. Again, the first chapter of my book is for free. We've got all sorts of other e-guides and downloadables. So we'd love for people to sign up. Again, this is a free event. It'll run for a week. And I just got to talk to so many great people about really what gets you sick, what keeps you sick, how do you start working through that? And I think people are going to be really happy because there's just so much great information. Terry Walls, Lloyd Burrell did a great talk on EMFs. So again, we just got so many really
and you guys have your own little talks too, it looks like.
And then, yes, we both have our own talks talking about, again, gut health, immunity, autoimmunity, microbes, environmental toxins. So again, I think we kind of give you a nice little snippet of all these things that we've identified as being sort of these root cause problems.
Great. Yeah, this is how I'm kind of doing my upcoming summit too, just doing some really focused mini talks every day. So you don't get too lost in all the options, so to speak. But then I'm also bringing on some really great experts. Yeah, awesome. This looks amazing. So it's called Overcoming Chronic Illness Masterclass, Infections, Toxins, and Mindset. Yeah, I love that topic. So you guys probably are familiar, but you just sort of opt in and then you start getting emails. You'll get some things right away. And then when it goes live, you'll get more goodies. Well, thank you so much, Dr. Ingels, for coming on. Anything else you want to say before we wrap up here?
No, I said I'd love to invite everybody who's tuning in to join the masterclass. I think you're going to get so much valuable information. You and I are both here to make a dent in the world, right? We want to really start transforming people's lives, empower people to take stock of their own health. And again, I think you'll walk away from this event having, a lot of extra tools in your kit to help yourself and your family get well.
Right. Awesome. Well, let me put back in that 4 Hidden Factors book here in the chat. Oh, there's also, I'm going to put this one in the chat. I can't resist 10 signs you need a lymph detox. I like that one too. So I'll call this one 4 keys. And then, I didn't realize you guys were doing this together. And then 10 signs you need a lymph detox. I'll put in here as well.